Namaskar. I am Dr. Kunjahari Medhi. I am Senior Director Medical Oncology and Hemato-Oncology in Medanta Cancer Institute in Medanta Medicity Hospital, Gurugram. Today I am going to discuss a few basic but very important points about cancer. We all know and very frequently use the term tumor. Tumors are of two types, some benign tumor and malignant tumor. Benign tumors are harmless tumor and malignant tumors are called cancer in general term. Cancers are of two types. These are solid malignancy and hematological malignancy. Because as we all know, our body is composed of solid part which includes all the organs, liver, lung, colon, kidney, etc. and the bones, muscles, skin, all other are the solid organ, solid part, and the liquid part are the blood and lymphatics. When cancer develops in the solid part, this is called the solid malignancy. These are like lung cancer, breast cancer, colon cancer, head and neck cancer, kidney cancer, etc. And brain tumors are also solid tumor. When cancer develops in brain, this is called brain tumor. Brain tumor also may be benign and malignant, but in brain sometimes benign tumors also give rise to serious problems sometimes. So, the brain tumors are treated differently, and when there is high grade brain tumor, and these are called glioblastoma or glioblastoma multiforme. And the liquid malignancy are the hematological malignancy, and when cancer develops in blood or bone marrow or lymphatics, then it is called hematolymphoid malignancy or hematological malignancy or hematological cancer. In blood we see the leukemia, these are acute leukemia and chronic leukemias, and lymphomas. This develops in the lymph nodes or lymphatics. These are Hodgkin's lymphoma, non-Hodgkin's lymphoma, and some other types of lymphoma are also there. And multiple myeloma are the also hematological cancer. This basically multiple myeloma develops in the bone marrow. This is also called bone marrow cancer. To diagnose a cancer, we need to know two important points. Number one, the confirmation of diagnosis, that means the type of cancer, and number two, the stage of the disease, means कैंसर कितना है, मतलब कौन सा स्टेज में है. तो कॉन्फर्मेशन ऑफ डायग्नोसिस के लिए, कैंसर डायग्नोसिस के लिए हमको चाहिए बायोप्सी और हिस्टोपैथोलॉजिकल एग्जामिनेशन, साइटोलॉजी मतलब साइटोपैथोलॉजिकल एग्जामिनेशन, देन सम फर्दर टेस्ट लाइक इम्यूनोहिस्टोकेमिस्ट्री, PCR, NGS, some molecular tests, FISH test, that is fluorescent in situ hybridization. These tests gives us the diagnosis as well as subtyping of tumor. For diagnosis of hematological cancer, we need some blood test, bone marrow examination, including bone marrow aspiration and bone marrow biopsy, then sometimes flow cytometry, cytogenetics, PCR, all these tests are needed to know the diagnosis of cancer. To know the stage of the cancer, we need some radiological tests like X-ray, ultrasonography, CT scan, MRI, whole body PET CT scan. PET CT scan are also of different type like FDG PET for other solid cancer and PSMA PET CT for prostate cancer, DOTA PET for neuroendocrine tumor. So, there are different types of PET CT also. So, to know the stage of the disease, we need different types of radiological tests. Diagnosis of some cancer, we have some blood tests. These are called serum tumor marker. For ovary cancer, we have the CA125. For colon cancer, we have the CEA. For prostate cancer, we have the PSA. So, like that, some tumor markers are also available. These are done in the blood. For treatment purpose, cancers are classified in different stages. There are different staging system available, but here in order to discuss the treatment of cancer, we will divide the cancer in 3 stages. These are local stage, when cancer is localized inside the organ. Then we have the locally advanced stage, when cancer is confined to the organ, but it has reached to the surrounding structure or adjacent structure, but it is not going to the other organ. When cancer from one organ reaches to other organ or multiple organ, this is called advanced stage or metastatic stage. So, for local stage and early stage, the local treatment, surgery or radiotherapy are needed. Sometimes in some cases we need some systemic treatment also. And for locally advanced stages, we usually invariably need multiple modality, including surgery, radiotherapy, systemic treatment, which include chemotherapy, targeted therapy, immunotherapy, hormonal therapy, etc. For advanced stage of cancer, usually the treatment is the systemic treatment, which includes, as I have discussed, these include the chemotherapy, targeted therapy, immunotherapy, biological therapy, hormonal therapy, etc. For hematological cancer, main treatment is the systemic treatment. These are different types of chemotherapy, immunotherapy, targeted therapy, etc. Sometimes in hematological cancer, like in leukemia and lymphoma, we need bone marrow transplantation also. Immunotherapy in the form of CAR T cell therapy or immune checkpoint inhibitor therapy are the most modern systemic treatment in cancer. Whenever there is any suspicion of cancer or any malignant disease, always you should make it a point that you should consult expert in cancer center, and treatment is started at appropriate time after appropriate diagnosis.